myself Dr. Yogesh from Astor Whitefield Hospital. I'm an arthroscopy and sports medicine consultant. We have finally wrapped up with the IPL and cricket season getting over. Most of the people are enthusiastic to learn more and more about the IPL or the cricket. So more and more people will get onto the cricket the very next day morning telling that, okay, let me start playing cricket. But we should also know what are the injuries that's most commonly associated with the cricket as a sport. So coming from shoulder to head to toe, shoulder injuries are very common in cricketers because of the overuse activities, especially in the bowlers. Too much of overuse activity and the shoulder gets injured very commonly, and even with the elbow. So the elbow also gets injured especially in the batsman, where because of the repetitive use in batting, the elbow also gets injured. The next common injury is hamstring strains, and coming to the knee joint, the most common is ACL ligament or the meniscal tears, and the most common after that is ankle sprains. So every joint or every muscle group is associated with some sort of the injury in cricket, as in any other sport also. Every role in cricket, either it's batting or fielding or bowling, everything has its own different strains to different group of muscle, causing different types of injuries. So how do we avoid these injuries? So very important is to have a thorough warm-up or a regular warm-up, and you have to strengthen specific group of muscles which is intended in that particular role. If you are a bowler, you need to know what muscles you have to strengthen. If you are a fieldman, you need to know what are the muscles you need to strengthen. So strengthening the muscles, increasing the flexibility of the body, and strengthening of the muscles go hand in hand. Both are equally very paramount. And after that is giving rest to the body. You cannot be training every day. You have to ideally train 5 days in a week so that your body gets rest and your muscles gets time to recover. That is very important. And maintaining hydration, which is very paramount, and the most important part is maintaining the hydration. So if hydration is good enough, the muscle recovery is also faster. So these are the things we have to keep in mind so that we don't get injured again and again. And very important is knowing the techniques, how to land, how to run, how to take a sudden turn. So especially when you're sprinting suddenly, the injuries are very common. So you need to know the proper techniques of each role, either it is batting, bowling or fielding. So what are the proper techniques? So learning techniques is also paramount. So with warm-up, strengthening, learning the technique, and using adequate protective gears and hydration, giving rest for the muscles to recover, you can definitely prevent most of the injuries in sports. We need to know the stretching and cooling after any exercise or after any game is equally paramount, because once you stretch, or what is called we cool down the body, then it helps the muscles to recover. It helps in reducing the soreness of the muscle, removing excessive lactic acid that is produced in the muscles, so that the recovery is faster and we have less soreness of the muscles. So generally we do some simple stretches of the shoulder and the elbow, and hip flexors stretching, and extensors stretching, hamstring stretches, and these are the general stretches, especially high leg bent knee stretches to stretch the hamstring, or even the downward dog or the rollover. And you can also foam rolling also can be done to cool down or stretch the muscles. So when you know that you're not able to bear weight on that particular leg or use that particular upper limb, you're not able to move it, or when you're doing some particular action, it is extremely painful, then that is the time you have to immediately visit the doctor. If it is manageable, you are able to bear weight but with some minimal pain, that means it is a minimal sprain or a strain which can be managed by yourself with some rest or some other medications. But if you are not able to walk, if you are not able to move that particular part or the part of the body or the muscle, then you have to immediately consider consulting a doctor. So we need to know what is the difference between a sprain and a strain and a tear. Sprain is when we refer to ligaments. The ligaments, when there's an injury to the ligaments, it's called sprain. But when it comes to muscle, it is called strain. So when you are referring to muscle injury, we call it a muscle strain. And tear is complete tear, whether it is a ligament or it's a muscle. If it is completely torn, then we call it a tear, complete tear. So when do we go, what do we do when we immediately get a sprain? So when you have a sprain, the first thing is protect the part. So don't move the involved limb too much. And second thing is you have to compress it with the crepe bandage or some elastic bandage like that, and then give rest to the limb and give ice packs maybe very frequently, maybe every 2 to 3 hours for 15 to 20 minutes. You can keep ice packs, which will try to reduce the inflammation and the swelling, and also keep the limb elevated. So these are the immediate things you are supposed to do it. And maybe, like, if it is you are able to bear the pain, not too much of pain, you are able to walk or you are able to use that part of the limb, then maybe you can take some simple analgesics, painkillers over the counter from the pharmacy, so that the pain gets reduced for the time being till the next day. But if you are not able to walk, or if you are not able to use that part of the limb, then you have to, instead of going over the counter medications, you can directly go to the consultants and consult them, because there must be something grossly wrong. So this is about muscle strain, sprain and a tear. So when it is a complete tear or a serious grievous injury, definitely you have to consider going to the doctor first rather than doing your own first aid.